because I want to touch people's souls, not just their body. The best you can have is a one good friend. Moving away from the religion, sometimes just talking therapies are more than enough. Khair aur barakat Allah achai. Life, if it does not have trauma, life, it does not have learning, it becomes boring.
I think we don't have to face the mental health problem.
No, 10 miles mama cycling go. What attraction is there if actually a person comes for your skin and not you? Nothing in the world can touch you. We should have somebody in our lives that we can talk to. A symbol of dignity in the community, which is such a shame.
Ladies and gentlemen, today I am excited to introduce our new guest, Dr. Sylvia Ali Khan, a renowned psychiatrist with a wealth of knowledge and experience. Dr. Sylvia received training in England and she had been work over there for last 15 years. Then she came back to our home country. Now Dr. Sylvia working here as a consultant psychiatrist in Northwest General Hospital. Welcome to our podcast, ma'am.
Thank you, Anas. Assalamu alaikum.
Wa alaikum salam. Ma'am, what inspired you to pursue career in medicine?
I think more than medicine, what inspired me to be a psychiatrist. I always wanted to be. Maybe because I belong to a family of doctors and I grew up watching them. I grew up seeing them work. And I believe that's where the inspiration came from.
And you pursue a career in psychiatry?
I always wanted to become a psychiatrist.
In the beginning?
Right from the beginning. I never thought of any other field but psychiatry.
Can you describe your journey from being a student to a psychiatrist?
Yeah. I think a huge amount of hard work. Definitely. Motivation, devotion, focus. In our times, we did not have a mobile. In our times, we were never addicted to series from watching it on Netflix or Amazon or whichever other media. We were very focused. And to actually achieve something, you have to sacrifice a few. And these are not even sacrifices, because I always tell my nieces that even if you did not watch this series now, 1,000 years later, when you will be dead, we'll all be gone. God knows, 100th or 200th or maybe 1,000 generation will be going on. They could still watch the same series that you're trying to watch now.
Exactly.
So what's exciting about it? You're not losing it. Even if you don't watch it for 10 years, you can still watch it after 10 years.
True.
And I think because we did not have that in our lives, our life was beautiful and more focused. We had more interaction,
Exactly.
We could set our goals. Our elders were always focused on the studies we were undertaking. They were always very much encouraging. Now even our elders are holding mobiles in their hands, So I think a lot of focus, a lot of dedication.
Exactly.
Yes.
Now, social media, we are close enough, but still so far.
No, I think we're never using the social media for the best that it offers. We're only using it for the worst it is offering.
Exactly. Totally agree, ma'am. Ma'am, what are some of the most common mental health issues you encountering in your clinic?
Mental health issues. I think mental health illness is becoming so common. I think it's about time we should stop ignoring. I think it's about time we should start accepting, because most of my patients, from a very young age group to a very old age, mainly people are coming with things like anxiety and depression. Anxiety, I will say, is on the top, and next to it is depression.
Okay. Anxiety is on the top, and the next one is depression.
Definitely. And unfortunately, it is mistreated by many doctors. And by the time they come to us, it becomes a huge challenge for us as psychiatrists, as the specialists in the field, to help them, because unfortunately, they've been mistreated by many other doctors.
Exactly, many other doctors.
And people don't know. They have to go to a psychiatrist.
Exactly, they don't know.
Yeah.
Ma'am, what advice would you give to someone considering a career in medicine?
In medicine, I think medicine is a beautiful field, but it's not a field for minting money. It's a field to help others. Yes, it has money. It has its bonuses, definitely. Allah does grant you rewards with it, alhamdulillah. But it's not a career to get money. It's a career to help others. I always tell my patients, they'll be like, I'll say it in Pukhto, che rashinoi che bas tal raghli wo bas khudena bas yote tabam roge. And I always tell them, it's not me. I'm only writing things and I'm only talking things. Khair or barakat Allah achai. This is what I keep telling them, and this is something we should remember.
Exactly.
We should never think we are the ones treating patients. We should never think we are the ones making people better or the medication is making people better.
Definitely.
Because it's not.
Yep.
Allah is putting His khair and barakah. Because it's amazing. You must have seen one doctor prescribes a medication. It doesn't work. You go to another doctor, he prescribes exactly the same medication and it begins to work. So do you think it was the medication?
No.
It was never the medication.
Exactly.
It was Allah's khair. So most probably the second doctor had more faith in Allah than the first doctor.
And the first one, yeah.
And with the faith in Allah, that medication became actually medicine for that problem. So anybody who wants to pursue a career in medicine, I think it's really, really important that they should be dedicated. They should come to this field out of the heart, not because their parents want them to be doctors, right? Because everybody's a doctor. Oh, because you know? Please don't do that. Please don't. It's such a prestigious, it's such a beautiful field. It's getting destroyed because it has suddenly become a symbol of intelligence and a symbol of dignity in the community, which is such a shame. Medicine was never meant for that. Medicine is it's a dedication to the people who need us.
Yeah.
It was never meant to show off. And I think that's what you should have in mind if you want to
pursue a career in medicine.
And then of course it will definitely has its hurdles. And those hurdles can be looked into. Inshallah, you will have seniors to talk to, inshallah, who will guide you. We are here, others are here. So there are many people who can guide you then. But if you're coming to it, come with an open mind, come with an open heart. Don't come here thinking people will say, I'm a doctor walking the face of this earth. No, there are millions others like you. Please don't. You're just embarrassing yourself.
Yes, totally agree, ma'am. I really like that answer. That's why I started this podcast, to know, like, people know it, that why you come to medicine. What was the definite reason that you come to medicine? So yeah, that's wonderful.
Thank you.
Can you share a particularly memorable patient case and what you learned from it?
God, I have many. I can't fully share them, but my part of the job is, I always say, somebody once asked me that why are you a psychiatrist? And I said, it's easy to become a surgeon, a physician, or a nephrologist or a gynecologist. And this is my thinking, I'm not saying. Because in all those fields, you have evidence-based practice, physical evidence-based. So a patient who's pregnant, you know she's pregnant. You know when you deliver, there will be a baby coming, right? A surgeon knows if he needs to cut off a part of you. He knows exactly where he's cutting and what he's cutting. A physician, if somebody's coughing, he will do tests. If somebody's sniffing, he will do tests. Or he will do x-rays. Or he will do MRI, right? So everything is so physically present there. In psychiatry, nothing's present.
Nothing.
It's clinical based diagnosis and what your heart tells you. So when somebody asked me why you wanted to be a psychiatrist, my answer was because I want to touch people's souls, not just their body. Right? Because every doctor touches the body.
The body of patient.
Yeah? We don't touch the body. We never ever touch the body. Even in ECT, we're using electrodes. We're not even touching the person. So we don't touch the body. We actually touch their souls.
Exactly.
and healing the souls. So coming back to your question, which was?
Memorable case that you had.
Exactly. So I had many. I think sharing the details of them is going to be horrific. I'm not gonna do that. But my patients, what I've definitely learned from them is I've seen as a psychiatrist, because we touch so deep into the society, into their hearts, into their souls, they come to us with a lot of pain, with huge, like a plethora of experiences of pain and agony. One thing I've learned definitely from them is, when we are either teachers, elders, parents, we have a huge responsibility. The children we're bringing up as elders, the juniors we have as teachers, the students we have. Because if the parents have not protected the kid, and if they come to me as a teacher, I should become that parent to protect my student. I should be that elder to protect my junior. Because many cases, and they're horrific, are the cases that are being ignored by the parents or their elders or their friends. So I'm sorry I cannot give you one case because it would be horrific if I were to share one.
Okay. Ma'am, what are some ways academic institution can support the mental health being of students as well as faculty?
I heard from someone in Saudi Arabia, the every person who is recruited by that hospital has to have one session per week or per 2 weeks, I think, or is it a month, with a psychiatrist for the well-being of the faculty.
Okay.
We don't have this here. I think the more we normalize it, because mental health is a genuine problem, and what we don't understand is if you catch it early, it never becomes a problem.
Yes.
So in England, we as trainees, we used to have a group. I'm hoping to create one here, inshallah. We used to have a group where all these doctors by choice will turn up, and we would have like a psychiatrist sitting there, 2 psychiatrists sitting there, and we will all talk about the difficult patients we have had in the week. Because it takes a toll on you, right? We would talk about the patient. We would share our experience, what made us feel bad about it, or how did it stress us out. And it would relax us. We would just leave that in the room. That person will never share it because that was very confidential. It would stay in the room. It would just disappear there, and we would all go back to work, and it would makes us feel so much lighter. And that was so much better.
I think we should definitely include that sessions here.
Yes, I think we should have it. Now, inshallah, I'm thinking of it. It's just that we're too short with resources. We're only 2 psychiatrists here. We do not have much other support. Inshallah, one day we will. Inshallah. And when we do. But before that, I'm still going to start it so that even when we increase in number, it will still continue, inshallah.
Inshallah. If you need any help, I will definitely.
Yeah. Definitely help will be needed.
Okay. Ma'am, what strategies do you recommend for managing stress and anxiety? As you mentioned this, stress is on the top.
Oh, anxiety.
Anxiety and depression. So how we can manage it?
I think the best thing is we should have somebody in our lives that we can talk to. Number one. When you have someone in your life, now whenever I say this, everybody begins to think singing around the trees with a woman. No, definitely not. It could be anyone. It could be your mother, father, your brother, your sister, a teacher, a friend, a cousin.
I agree.
It could be anyone. You do not always need the opposite gender. No. It can be the opposite gender, but can be of any position, any relation. And it's really, really important that you trust them and they're trustworthy. Not everybody's trustworthy. So if they're trustworthy, you can go and offload your stress. And that is where the stress goes away. Number 2, stop for goodness sake, stop using mobiles. It's creating so much stress, so much of mental illness, so much of interrelation problems. It's horrible. So no use of mobile would be excellent. But if you cannot do without a mobile for genuine reasons, then make it the least. They should be literally restricted hours. You should not go beyond those hours. And thirdly, you should have routine. Our religion is beautiful. It tells you to pray 5 times a day.
Yes, ma'am.
And it gives you a beautiful routine.
Yes.
And for boys, it's even better because you have to go to mosque. So it gives you that extra exercise. You get to see new people. You could be in a position to help so many people.
Yes.
So have routine in life. Pray 5 times a day. 5 times a day. Read Quran. And between those timings, between 2 prayers, have a set routine. So say, suppose like you've gone for Fajr, and after Fajr till Zuhr, you could do many things before coming to college. You still have 3-4 hours in the morning. You can go for a nice jog, walk, exercise, have a nice, full, healthy breakfast, and even if you've got some nice friends, that is the best time to get together.
Yes, ma'am.
And then together go to college. And then between Zuhr and Asr, that is another nice time. So you have your classes, your college, and you should have a nap. In between Asr and Maghrib, you should be up. You should go for your prayers. And between this is an excellent time to study. Right? And right close to Maghrib, have your dinner. Go for Maghrib. Come back, do a little walk, and sleep. Life is wonderful when you don't have this electronic device sleeping next to you.
Exactly.
Honestly. So have routine, healthy eating, good exercise, Quran, prayers. Nothing in the world can touch you.
Totally agree, ma'am. Ma'am, as you mentioned about leaving mobile phones. So coming to the questions, can you discuss the impact of social media on mental health?
Oh, like I said, there are many studies that have been conducted, and they're showing children who do a lot of games that involves killing, shooting, fights. The regression level is higher as compared to other children. Similarly, people who have a lot of screen time, not just games, watching dramas, programs, and stuff like that, they have lesser social skills because the 2 parts of the brain, one is more perceptive to visual presentations, the other is more to touch. Okay? So when you're just watching everything visual, right?
Yes.
What happens is the other part of the brain becomes weaker. When it becomes weaker, when you come out in public, you're awkward. You don't know how to talk. You don't know how to say hello.
Exactly.
I mean, online, you're sending hearts to everyone.
Yes, ma'am.
Try doing that in person. They'll kill you.
Yes, ma'am.
You can't be just carrying hearts and giving it to, or sending flowers to everyone. You'll be dead.
Yes, ma'am.
Yet, we do that online and we don't consider it wrong.
Exactly. Like, ma'am, majority of the time, people, the one who can talk, amazing online, actually
They're
he can't talk
zero.
exactly in.
They're literally zero in their real life,
Yes,
right?
ma'am.
Because in their virtual lives, they're heroes. In their real life, they're zeros, And this is exactly what the media is doing to you. Because media actually, when you're holding a mobile, you live in a virtual world. You're a hero in your own world. You have control over what you're watching, what you don't want to watch, which heroine or hero is your favorite. You can skip the ones you don't like. You can only follow the ones you like. When you come into real life, you lose your brain over it. You're not as intelligent because you think you can do the same in real life.
Exactly.
Oh, exclude this because I don't like him or her. Oh, let's bring them in. Without considering whether they are going to even tolerate you or not. You like them does not mean they like you too.
Yes,
So we are beginning to live in such a virtual life because of the media that we're forgetting what etiquettes are. what ethics are, what behavior is, what confidence is, what self-esteem is. Because online, thanks to all these pretentious filters, you're this most handsome man, I would be the most beautiful woman walking the face of this earth. But when they come and see me in reality, they'll be like, what
Exactly.
are you, So our own confidence has been stripped off us. Our self-esteem is gone. Our intelligence is fading away because we're never watching anything intelligent. Only few clips of intelligence, everything else is rubbish. Watching pranks. I mean, what are you learning from pranks?
Exactly. Watching pranks, watching vlogs, watching daily vlogs.
And coming to vlogs, it's horrific. Would you actually go into somebody's house and watch them what they're doing?
Exactly.
And that's what vlogs are doing.
Vlogs are doing, exactly.
You're actually going into a person's home, into their personal life, and you're watching them. And you consider that okay.
That okay, exactly. And you don't need that.
No. So media is destroying us. Screen time. It's taking away our intelligence, our confidence. It's taking away our mental health. And it is isolating us. People who use a lot of social media have the least number of people they talk to. They don't have friends.
Exactly, they don't have friends.
All friends are virtual. They have like 1 million followers. Not a single one comes to ask them, how do you do?
Exactly.
Yeah. So it's taking our intelligence away. An
Totally
intelligent
agree.
person will not do that, would they?
Exactly. Ma'am, I love the answer that you give such an amazing way that I will listen it again and again. So thank you so much, ma'am, for this amazing answer. Ma'am, what do you consider to be the biggest public health issue facing our society today?
We mentioned one, social media.
Social media.
That is the biggest. Second is, Bachia, moving away from the religion. We are moving away from the religion.
And we think, ma'am,
we're advanced and modern.
Exactly, ma'am. That's the
Right?
thing that
If I cover my head, people think I'm very orthodox. Well, I'd love to be an orthodox. I don't mind that. But people think I'm backward. I'm not backward. If anything, when humans came to the world, there was no parda. People were walking around with the least clothes, right? They were hiding their satar, but they were not well aware of. So the advancement means you have to cover yourself.
exactly.
They becoming naked means they're going back in time.
They're back in time.
So they're not advanced at all. If anything, they're regressing, unfortunately. But they think it's advancement. If you don't show a little bit of skin, you're not attractive. I mean, what attraction is there if actually a person comes for your skin and not you?
Exactly.
How pretentious. How much of a hypocrite do you have to be like that, So
Ma'am, social media make us more hypocrite.
it has.
Like more.
We
and
are
more.
very beauty conscious. We are very
Wealth conscious.
status conscious.
Agree.
Yeah, we're conscious of how many girlfriends we have, how many female followers we have, how many cars, how much wealth, how our parents. Oh, the more batamiz you are with your parents, the more popular you are.
Exactly.
How horrible is that? I mean, since when has that become our culture? And our culture is getting destroyed. We are getting destroyed.
Exactly.
Our generation. I mean, I've spoken to boys younger than you, and when they say, they've said things like, "Ma'am, ये जो आने वाली generation है, Allah ही बचाए." When they say that, and I'm like, God, I'm saying this about you guys.
Exactly.
And if you can say this about someone, I don't even want to know why you're saying this, because it's scary.
Scary.
It's
exactly.
horrible.
It's horrible. Yes.
So we are losing ourselves to the social media, to the pretentious life, because we think money is everything. We think if your husband takes you out for dinner 6 days a week, oh, you're the happiest wife on the face of this earth. No. When you're wearing clothes of a certain brand, or you're carrying a bag of a certain brand, or shoes of a certain brand, right? Oh, you are the happiest woman. No, you're not.
Exactly.
You're seriously not. Simplicity has so much happiness, so much satisfaction, and so much ease And that is something you know when you go to bed at night, you hit the pillow and you're asleep.
Exactly. Perfect.
You know?
Perfect.
So I really wish and pray that we will grow some brains, as I always say, over a period of time, and we will understand the value of ethics, the value of good characters, morality, religion, respect.
And that's what attractive is.
It is the most attractive thing in anyone.
Ma'am, looking back, what advice would you give to your younger self?
Good thinking. Okay. I love my mistakes. I don't think you would hear that from many people. I love my mistakes because they have made me stronger. They've made me a better person. And who I am today is because of my mistakes, not because of my success.
Totally agree.
Success takes you down the drain and your mistakes takes you up, right? So I love my mistakes. They're very dear to me. And Allah also says that never use the word if because you're challenging him, right? So I've learned a lot from my mistakes. One thing, if I were ever to say to myself, is don't change for the people around you. Be yourself.
Be yourself.
If you're honest, if you're truthful,
Sincere.
you're sincere, to hell with the world. Just be yourself.
Be yourself.
And I think one thing more I could tell myself is you're never going to learn anything or earn anything out of talking about others. Because everybody is full of mistakes. I must have done that too. I know I've done it. I'm not going to be shy. I'm embarrassed about it. But I can't hide it because Allah is my witness. So talking about somebody will give you nothing.
Nothing, exactly.
Yes.
Instead we should focus on ourselves.
Yes. There will be times you're upset with people. There will be times people hurt you. Leave it to Allah. And Allah deals in the best of the ways.
Best. Exactly. Ma'am, can you discuss the challenges and opportunities for women pursuing career in medicine?
I think we don't have them anymore. We used to, because now I told you it has become a status symbol.
Yeah.
So now everybody wants their daughter to be a doctor.
To be a doctor, exactly.
And thankfully, many people now do want their women to be educated. Unfortunately, we still have some less intelligent people among us who don't think women should be educated. But can I say something else? It's not just education. I think we always relate education to books. Education is from everything.
Everything, yeah.
Do you remember that tale of Timur when he kept going for conquering this country and he couldn't? And then he was sad and he saw a spider trying to climb and it kept falling and he kept watching. And he got the inspiration from it that if this spider and ant, if they can do it, why can't I? The next time when he went, he burnt everything around himself so nobody could run away. And he actually won the battle, right? So I think it's really important to understand that. Try again. And learn from everything that is around you. Don't limit it to just books. Learn from your elders, learn from your younger generation, learn from your contemporaries. Because there's a lot of education in everything. Everything Allah has created around us is full of ilm.
Yes.
And that ilm is there. It's just we're not seeing it.
Exactly. You should be more like close observer.
Yeah, and you should be educated here.
Exactly, educated here.
Not just in your labels.
Exactly.
You should be educated here.
Totally agree, ma'am. Ma'am, what are the signs that someone should seek help from a mental health professionals?
What are the signs? Well, if you can't find anyone else to talk to, if you don't think anybody can understand you, or if you feel embarrassed in talking to others, which simply tells me you don't have anyone to talk to, that's the time to come to a mental health professional. But be careful, it's not all about medication. Sometimes just talking therapies are more than enough.
Exactly.
Yeah.
Totally agree, ma'am. Ma'am, what advice would you give to someone considering a career in psychiatry? in your field?
Oh God, please, please, please don't become a psychiatrist only just because you could not get through to medicine or surgery. Come to psychiatry because you really want to become a psychiatrist.
Exactly.
Please, because unfortunately, we always, most of the time, we get the leftovers. So when they come to psychiatry, they treat psychiatry in a very insulting way. They don't treat it like it should be treated.
It should be
I came to psychiatry right from the beginning. I always wanted to become a psychiatrist. I've seen so many people wanting to become a cardiologist, wanting to become a surgeon, wanting to become this or that. They keep trying, they keep failing the exam, they don't get through. The next thing is, oh, I'll pick up psychiatry. No, please don't. Please don't.
Okay.
Don't disgrace this wonderful field.
Exactly. I love it so far. Like, I also love it, and now I'm exploring it. When I explore full, then I will maybe
Inshallah.
I will
Oh,
choose.
please come. We need people who really want to become psychiatrists, not because you couldn't fit somewhere else and then you ended up in psychiatry.
No, ma'am, it's not my thing.
Yeah.
Ma'am, what role has mentorship played in your career, and who have been some of your most influential mentor?
Good question. A very good question simply means I have to dig up an answer which I don't have. My mentor, I have been a very religious person from a very young age. I've read a lot of hadiths. I've read a lot of books related to Islamic way of living. Exploration of Quran came a little late in my life, although I read Quran very early on, but not the exploration of it. But a hadith from the very beginning of my life, my father would read hadith to us every night. And I think that's where the inspiration kept coming. And then myself, I read some books because Daji would bring books and I would read those. And I think my mentor has been my deen. My religion has been my biggest mentor. In the physical form, I can't place anyone. I've taken inspiration from multiple people. So I've not had just one person to go to. I've had multiple people in my life, my elders, mainly my teachers.
Like, you just pick the right things from those people.
Yes.
And adapt it to yourself.
Yes. Yes. So rather going for one person, the one consistent has been my deen, my religion has been the most. Even today, when I have no answer, I open the Quran, I go into tafsir, I read. If I get any hadiths handy, I read upon those. I would contact alim, and throw my question to them. Even today, I do that still. But if it comes to anything else, then I pick up inspiration. I pick up inspiration from my patients all the time. All the time. My students, I learn so much from my students. I do become harsh sometimes, and then they get upset. Then I get to know, and I have to rethink my position and improve on that. Or I may say something that would upset them. I would rethink. Try and make myself better. I'm a human being. I still do a lot of mistakes. I still do.
But if you have, ma'am, I really like this approach to life, that if you have the ability to, each and every day improve yourself, be the better version of yourself.
You have to be.
I think that's wonderful.
You have to be. You will fail. You will still fail.
Exactly.
I keep failing. I keep failing, but I keep doing it. I sometimes leave myself some signs in the room to remind me not to do that again.
Not to do that again, exactly.
And it helps me. Alhamdulillah, it helps me. But I fail. I still fail.
But you still try.
Yes, I try, but I fail again.
That's what amazing, ma'am. When you fail and you still try. Yeah. You fail and still try.
And I think that would be the best thing to do.
Exactly. Wonderful, ma'am. Ma'am, what impact does trauma have on mental health?
Oh, a lot. It has to do a lot with trauma. Yes. A trauma will either make you or break you. Literally. It will either make you or break you. In my own life, I've had traumas. It broke me first, but then it made me into a wonderful person. I think I'm a much better version of myself before the trauma. I'm a much improved version of myself. There's so many, my insight into things have changed.
after trauma.
Yeah. Oh, amazing. But this is the thing. When trauma comes your way, stop crying and saying, Allah name kwa. For goodness sake. How can you even say that if your hands are okay, your feet are okay, your eyes are still working, your ears are working, your mouth, your tongue is working? How can you say Allah doesn't love you? For goodness sake.
Exactly, ma'am. Like, if Allah throws some, hardship on you,
Yeah.
it's mean He wants you to grow.
True.
Exactly. So
Exactly.
I think you should take it for granted, and you should learn from those mistakes.
Yeah.
And
No.
grow.
Don't take it for granted. Don't take it for granted. Take it as an experience. I mean, how boring life would be if everything was perfect. There's you must have heard of that story, the people of Sheba. I think it's mentioned in Bible. There is a reference in Quran. And so there was this huge civilization. There was civilization divided into two, and they were between them ran a very a large river of clean water, drinking water, right? And this civilization had actually developed on the banks of it. So the two sides of it, so they were lush green fields. There were a lot of orchids, and people say they were so prosperous that when they were traveling, they would never carry anything with them. So they would never have any travel bags. Why? Because they had so many places to qiyam, there were so many places to stay before they could reach. Say, suppose if they're traveling from here till here, they may have like 4 spots to stay, and every place would have everything you would ever need. Right? So there was no need to carry anything. Can you even imagine? It must be Jannah.
Exactly.
So they would never carry anything. So they would come here, then come here, do their job, done, and back.
Exactly.
So when they would go back, and they also say that if a woman was to carry a bucket, empty bucket, on the top of her head, from one end to the other, she would not need to pluck a single fruit or a single vegetable. All she had to do was just carry it on the head. By the end of it, it would be filled with fruit and vegetables. So it was so prosperous in every way and so fertile the land was. Yet one day, these men or these women, maybe even, when they would be traveling for the sake, they were the best in trade and everything. So Allah Ta'ala was very kind to them. And what happened was, when they would travel, the men became bored. They were like, oh, Allah khanna kai. We should be carrying something with us.
Exactly.
I wish this was a little longer. I would like to feel the journey. Those stupid things that we humans do, right? So Allah dried that river. That civilization does not exist anymore. So life, if it does not have trauma, life, it does not have learning, it becomes boring.
Yes.
And then we are yearning for things that includes a bit of trauma. Like just this civilization who were had the best of everything, yet they were hoping for a little bit of pain.
For a little bit of like hardship.
Yes. No, life is perfect the way it is. Traumas have an impact on us. If you take it as a learning experience, it will make diamond out of you. If you take it as a defeat, you'll turn into coal and burn somewhere.
What advice would you give to aspiring medical professionals?
Aspiring medical professionals? Dedication, commitment, devotion.
Dedication.
Don't come to the practical field thinking, usme paise hi gatam. Please don't. Muझे पैसे वाला असीम खुदा दर कई आगा अल्लाह लुई बचा दे अब दर कई ते लग परोगने थे कारो कनो ते चकल 10 रुपए गटे बप लकुनो द पासे औ चे पदीनियत राजे चे लकुना गटे बचिया लस बंदे जेब के न बात की चे सिंगर राजी अक्का से बदना लव बासी कल बप बीमारे बासी कल बप बदकारे उजी बदम ले बउजी no dina less gata the khair dake gata.
Exactly. And you should be peace as well.
Yes. And try and learn more and more. په یو ځای کې ودرېږئ مه learning کوئ
Learn.
you know whether that means چې ته به نورې ډګریانې الی whether that means چې ته ډګري نه الی ته صرف آنلاین لرننګ کوې ته بکس لرننګ کوې don't stop یو انسان a doctor is not just a doctor you should be holistically present
Exactly.
you know you should know a little more than just دوایانې او کتابونه
Exactly.
be a human being so don't stop being human when you do become a doctor
A doctor. You nail it, ma'am. Ma'am, how do you approach the treatment of addiction and substance abuse?
or how do I approach it? The first thing is please do not look down upon them because the first thing we say is che to druggy you know you're addicted tik daga te addicted ajes khota la dil khuna dira gali kana che ta daga pa ma khagar sarota pe che kam ga khpala tang de
Exactly.
you know so treat them like a person who is in need management planning the bachia we work on different dagake we work with that and you have to work with them damo che tuba ma sarakar ke you work with their time
Like
mutual nade bachia it has to be patient centered Mike I always tell my patient che zaba pagizam che kambane tasu ma pose ma data me makwe che zaba tasu zan sar raka gam tasu ba ma zan sar raka ge you know it's really important to be patient centered
Patient center.
because agwilat the work that right so that they can do what you're doing for them and they will continue to do it for them inshallah
Inshallah. Can you share any success stories that highlight the impact of effective mental health treatment that you treat the patient?
Oh, alhamdulillah. Yes, alhamdulillah. I've had patients who've been maltreated for 12 years of their life and they come to me in a state of anger, anguish, disappointment. Your doctor tikna de dana kagazuna payom tikna shwam and summa alhamdulillah they have got better. I have had very educated people coming to me who have been to very big doctors and those have never got better and when they've come to me summa alhamdulillah they've got better. Alhamdulillah.
That's wonderful, ma'am.
Oh, wonderful is a very tiny word.
Exactly.
I always tell my patients, when they come to me and their mood is not good and I'm dreading that they have not become better, and I ask them, "Khashive?" I literally am scared to ask, and when they tell me, "Doctor said, bilkul." Then I'm like, oh, alhamdulillah.
Exactly.
Why are you scaring me? No, yes, but wonderful is a very small word. It's a very small word.
Small word, yes.
When our patients get better, it's a different kind of a feeling.
Exactly, it's a different kind of experience.
I don't think I can explain it. But yes, inshallah, once you experience it, you will know what I'm saying.
Inshallah, we will experience
Inshallah.
it. Ma'am, what are some ways to improve mental health awareness and education in schools?
But yeah, we have to destigmatize mental health. We have to destigmatize the fact that we can talk about mental health. I think one good thing about this new generation is they're not afraid to come to a psychiatrist. This order the mothers are saying some doctor na psychiatrist some doctor can you imagine?
Exactly.
But she was a psychiatrist.
Exactly.
Like a psychiatrist to do some doctor. How sad is that?
Exactly. How sad is that?
No, because अक्सर रूम की ना समझो तो खान दमा no मैं दा मैं ज़रूरत मैं बेज़रूरत है मैं मुझे ताना ज़ा तो ख़ैर रास्ता बचाया था you know she knows exactly what she wants and what she needs not what she needs exactly. Basically no alhamdulillah the new generation they are not looking at it as a stigma
exactly
they're looking at it as a need of the day they're looking at it your problem day alhamdulillah the solution and we should find the solution you know so they're not like my generation or the ones older to me in my generation ke usam doctor anche unfortunately keen you know damla se doctor it's sad it's really sad khuda usam ki
exactly
usam che de zamga no doctor an psychiatry treat kai ligya de which is unfortunate because the norm stigma jodavi the stigma dasi jodai chi kisam ki amaris the veli kigi chi zade goram na gila sita ya agala sita you know psychiatrist bas di so badana khabaram nishi rog bashi you know
Exactly.
it's very sad chi that the stigma promotion ki zamga the dero educated khalko laste
They still promote it.
yes
I agree, ma'am. Ma'am, can you discuss the role of diet and exercise and mental health?
oh of course chi singa ma shuru ki wele chi routine is a must routine is a must او غي کې روټین کې د منځنه پس د قران نه پس exercise او healthy diet ولې چې نن سبا څه کم processed food چې موږ ستوي نن سبا کوم ما په خیال د نیم نه ډیر څه 80% موږ چې کم fruits vegetable کو hybrid دي ټیک شو hybrid کم دی بچي هغه کې nutrition کم دی هغه کې خیر کم دی او بیماری پکې ډیره ده او بیا هغه نم زیات processed موږ چې دا chips packet خورو کوکونه خو شربت اسکو you know دا شیزان چې they have no nutrition زموږ دماغ زموږ ټول جسم په nutrition چلیږي
Exactly.
او هغه healthy دغه نه راځي نو healthy diet خو مطلب زم یو کس په ډېر کم کلی چې په دې خبره نه پیږي او بیا چې کوم دی exercise of course because موږ چې exercise کوو زموږ جسم کې خاص هارمونونه پیدا کیږي ډوپامین پروموټ کیږي you know endorphins راوځي نور څه ډېر څه کیږي چې کوم موږ ریلیکس کوي او موږ خوشاله
Exactly.
او جسم الله تعالی جوړ کړي
حرکت لري yes.
د مړی چې دی کنه هغه حرکت نه کوي you know when we're dead we don't move so exercise is essential rather important amna essential
for
زموږ صرف منځ example والا ټول exercise mode دی ودریدل خوځیدل ټیټیدل پاسیدل ټول ستا مطلب joints لم ډېر زیات ښه دی for your body for your health everything لا ښه دی even زموږ خپل دین موږ ته دا promote کوي
exactly
you know so yes very very important
exercise. I think, ma'am, if we perform prayer 5 times a day and we make a schedule, I think we don't have to face the mental health problem.
No, not at all. Like a बीमारी बा किदी शी ब्याम सन सराशी बचिया बची कम नन सबा गड़ा दा खो बनी कना indigestion खिटे खराब है skin खराब नजरून खराब موټاپه obesity
is
دا شیزان خو بنی د دې نیم مرزونه خو د دې نه جوړ دي
exactly obesity ma'am hypertension and diabetes
and heart
exactly
cholesterol دا ټول د دې نه جوړ دي بچیا نو چې دا نه ته سوچو کا یو خو ډاکټران د کار نه وزي او کې څه بده خبره نشته healthy society would be a wonderful society ټیک دی بچیا او بل دا دی چې سب سن خرچي بچی شي
if you do just one thing
yes
just do exercise
yes
so keep that in mind okay ma'am how do you manage your own mental health and self-care as a psychiatrist
oh god how do I manage my own mental health زما خپل mental health بچیا because my entire work is talking because I do more talking than giving medication no by the end of the day I am exhausted I'm so exhausted zakala kort ladasham zama da khabar zorni I just go quiet the chicken and the best kamas bani so ehsan kai abadai chima de so pridi chiz ma kham tarmas khutan udasham and then I'm fine this is how I do it in daytime I don't get a lot of time for exercise because my commitment stays zyati usually evening is a 15-minute walk 20 minutes walk nan sab garme ke dono badhali ho you still have to do it because it makes you feel so much better I read I sometimes watch some documentaries regarding the Muhammad Ali I will highly suggest boxer Muhammad Ali oh amazing man yeah the kitchen so inspiring the chivi the we struggles yeah the
stories and struggles hardships
yes but I make sure I keep it limited as limited as possible chikala didi ki zama pa sar dard ji shi zama ki chirchirahat raji ma ta pata legi che I've gone beyond the needed amount and the other thing is I love animals so I have a lot of pets and spending time with them again relaxes you
exactly
gee it really او که damni no I khaza khoim bya window shopping and that because Agayo mantak dade che when you go to a shop, you're not thinking about what's going on here or what happened here.
Exactly.
Or what is going to happen here. You begin to live in now and then.
Exactly.
You know? No, because when you go to the shops, you see different colors. You see different styles. You pick up different smells. It's very healthy. Delta Peshawar, unfortunately, this is a Zaina Shtena te Bahuna di Chichartam Zeno. Unfortunately, Sadi Pagutunu Kivaladi Delta Bos Khazira Rawani. For us as women, it becomes very hard. Like England, I would go for cycling. 1 hour cycling was a must for me. Zaba Korta Chiralam no 6 na 7 pure was my cycle. 10 miles by my cycling go, which is amazing.
Ma'am, what message would you like to share with listeners about the importance of mental health care?
Your mental health maintenance the para sleep, exercise, diet, routine. Nothing beats it. और दस मलगरों के दस खलकों के खुदा के हम रिश्तेदारान वाली नहीं एक नास्ता पास्ता प्रेग दे बच्चियाँ छे कम तारा negativity दर कई ताप गलत हो दतुनु राड़ी बच्चियाँ तो लोग all they're talking about stupid things ठीक ते बच्चियाँ पर समय खबरों बाने खबरें न कई videos हम चंदा था share कई नो गलत videos दस share कई बच्चियाँ दास किसानों के नास्ता पास्ता मकावे बच्चियाँ वाली छे the life देर जाते
exactly
you know او دغه مومنت ډیر کم دی خو د دې زور دونه دی کنه چې ستا د ټول جون پکې راپټ کی.
Yes ma'am.
You know, so we should avoid such companies.
Yes ma'am, we shouldn't even close or near to those people who are always talking about negativity.
Yes, we should go away from them.
I'm also working on myself to leave those company, although I don't have, but still I do not want to interact with those.
No, you must not.
Exactly. And I also suggestion to you guys that you should always leave those people who always talk about negativity.
Yeah.
Whether he is your friend or whatever.
Or even your family.
Exactly.
Don't sit with them. Only go say hi and bye. That's it.
Exactly.
Honestly, having a good company, Gore Hazrat Umar Rizal has said, the best you can have is a one good friend. Right?
Instead of like 10.
Yeah, the best person you can have in your life is one good friend. And if you don't have him, it's best to be alone.
It's best to be alone.
Not alone with mobile.
Yes.
No.
I agree, ma'am. Ma'am, describe your mother in one word.
Inspiration.
Ma'am, what book has had a significant impact on your life?
Sorry, my mom is very inspiring. A book? No, there is no single book. Many books. I mean, it might sound like I'm repeating myself. There's no better book than Quran. And I mean it when I say it. You learn it, you read it, you understand it. Oh, yaar, kasam de din khaista kitab bal nishta.
But ma'am, the thing is, people are just reading it.
Yeah.
Exploring is something else and reading is something else.
Yeah.
Like I read for last, sorry to interrupt you, I read for last like 8 years, like I will read daily, but I was not exploring it. Then, may Allah bless him, there is a doctor, I sit with him and he asked me, did you ever read Quran? I said, yeah, I read many times and in every, Ramadan.
But that's not reading, is it?
Exactly. And every Ramadan I read like 5 times, 3 times the whole Quran. So he said to me that, did you ever explore it or you are just reading it? And I said, no sir, I just read it. And he said, no, you never read a Quran, you should go and you should explore and you should understand it. Then when I came to home and then I exploring that things, now still I'm exploring it.
Yes.
And like it changed me a lot.
Oh yeah. And the thing is, the amazing thing about Quran is, you read it once, you understand it, and you think you've understood it. You read it again, and you be like, it's a new book.
Exactly.
And I must have, alhamdulillah, done it about 2-3 times with tarjuma and tafsir. And every time I'm reading it, it's like,
exactly. I didn't get that point.
That point comes in, and then I would read it, and it's beautiful.
Actually, ma'am, if like in my mind, if you explore the Quran properly, I think you will be more humble, more sincere,
And you'll be
not egoistic.
Yes, and you'll be scared of your akhirat.
Exactly, and your entire attitude will be changed. You will not follow the crowd.
Yes.
You will make your own path.
You'll be the leader for the crowd.
Exactly.
Yes.
So I think definitely you guys should explore the Quran. Definitely.
Oh, definitely. And
worth it.
Some good books would be to read books which are inspiring. So read inspiring documentaries. Again, boxer Muhammad Ali, amazing. Amazing.
Such a brave person, man.
Oh, he was one of his kind, literally one of his kind. And Nelson Mandela is good. However, I don't know. I got for me, it was, I think the version I read was a very lengthy one. I like to read more of the personality rather than their struggles, because the struggles should show more of their personality. So my reading style is slightly different. Malcolm X, yeah. And then I also read some fiction. So Al-Shabaabili, The Alchemist. I hope people have read it. It's an amazing book. There is another book by Yasmin Mujahid, Break Your Shackles. Amazing! It really helped me when I was down in dumps, and really helped me. It's an inspiration from the Quran. I think she's an alima, or she's a preacher, and she would do the Quran tafsir and will allow you to reflect upon life through the Quran. So it's a beautiful one. Yasmin Mujahid.
Name is?
I think it's Break Your Shackles.
Break Your Shackles.
Yeah. I think it is. But Yasmin Mujahid. You Google it, and she's written 2 books. I've read one of them, the first one. It's like a yellow page with a tree and leaves. But it's beautiful. Break Your Shackles. Yeah, I think it is.
Okay, wonderful, ma'am. Ma'am, the last question is, what advice would you give to me?
Oh, okay. As a person, okay, I'm going to be honest, I don't know you much. Okay. So giving you advice without knowing you is going to be very horrible, because it might be like, say, मैं अपना ढोस जमा रही हूँ because I'm your teacher.
No, ma'am. But still, I want to listen. Anything you want to give to me.
Generally, an advice would be, don't lose your honesty, and don't lose your morality over things that is going to destroy you. Because once you part with your best friends, which is your morality, and your ethics, your good behavior, your ethics includes honesty, truthfulness, and everything. Yes, these are your very best friends, which will also be there with you in your qabr. If you're going to lose them, know that you're dead. If you're still walking, talking, earning, you should know you're dead. So never lose your morality and your ethics. Just even for the sake of conversation, for the sake of a person, for a sake of revenge, people do it. But you never know whether you will ever get a chance to say tawbah. You never know Allah would even forgive you or not. We don't know that. Protect it as much as you can today, what you have today, and be grateful every morning when you wake up. Be grateful that you're alive and you can still do so many things.
Exactly.
And if you will stick to this, inshallah ta'ala, there's no turning back. Stay with Allah. Trust in Allah. He has much better plan for you than you have for yourself.
Exactly. Totally agree, ma'am. Thank you so much, ma'am. Ma'am, as you mentioned that revenge, so I'm in the middle of conversation. I'm just saying that when I was 3 years back, I was a person that when someone did something to me, I was keep in mind that I will take revenge from that person or from that family or whatever. But when I explore the Quran a little bit, even though I just read once, I will read it again and again, inshallah. Totally change my perception. Whatever people do to me, whatever they're talking behind me, I don't care.
Do you know, this reminds me something. There is a hadith Our hadith it says one day somebody asked Muhammad sallallahu alaihi wasallam, who is the most is there a person like you feel so sorry for, like a tuluna muflis? There's a word that's used. Tuluna muflis kam kaste. I think the word is something like this. No, Muhammad sallallahu alaihi wasallam said, the man who on the day of Qiyamah he would come with good deeds as big as a mountain. He would bring all those good deeds with him to Allah, because Allah will be judging us against our good deeds and bad deeds. No, he will bring that big amount which is as big as a mountain. And when Allah will open his Amal Nama, what the Amal Nama would have is, he has hurt this person, he has hurt that person. He talked about this person, he talked about this person, right? That person. Now Allah would do what? Do you know how Allah, the Allah Insaf Singh, he will take one of his good deed, give it to the person he has hurt. Then more good deed, he will give it away. He has hurt and he has caused problems to. His mountain will disappear. All his good deeds will be given away. But the list of the people will still not finish. So then what would Allah do? He will take their bad deeds and give it to this man.
Exactly.
It gives me goosebumps.
Exactly.
Da zamunga ikhlaq, our morality, because morality includes all these things. Our ikhlaq, our morality, our good deeds, munga da Allah yara bachiya. Qiyamah for us on the day of Qiyamah will keep us in good books with Allah.
Exactly.
Otherwise, Allah de maaf sati, we could be that man who will lose all his good deeds and carry all the bad deeds. And this man will, do you think he will go to Jannah? And Muhammad sallallahu alaihi wasallam said, "Dana gat muflis nishta." And I feel like we feel sorry for this man. So what were those good deeds for? Exactly. Similarly, kaso che a day zyad nek kaso. So he would fast in the day, he would do tahajjud, he would do all his prayers, and he would do all the farais of a Muslim. And when he passed away, everybody was like, oh, Khuda Allah Ta'ala Tadir Grano, and he must be already forgiven in Jannah, in Jannat al-Firdaus, right? One of the people actually dreamt about him. And the man says to him, can you just go to that person and ask him, has he forgiven me for using tinka sitawai bada buso na dagaybi agad? Go and ask him, has he forgiven me for that? Tinka de mata maaf ki. No, akas vartawai what do you mean by this? One day I was standing next to his house. Amunga late nawarko the buso or the khato. So that man's house had that on the top of his house. He was standing there and he picked one of that bus to clean his teeth. It did not belong to anyone, isn't it? Right? It did belong to the man.
Exactly.
We Allah mata we chikada sari ta padi khashizu na bakhale. Sta bakhana nishta. And this man did no bad deeds. He had done no bad deeds. That was his only bad deed. He never took permission. We do so many things without permission. Exactly. College hospital tarashum, the pen milosh, wala jeb ke keda, wale jeb ke keda.
Exactly.
Is it yours to take home? It's not yours to take home. Please leave it there. Paper ravala awasha drisalo day ravala mata hostel ki pakar di. Why biche? Ta qarz de pata bande. Or the qarz but the jawab varkai yoras. Best is to don't do it. If you've done it, say tawbah and move on. So my advice would be, biche, stay honest. Fear Allah. And I mean it, fear Allah in everything you do. And there's nothing in the world that can beat you. Nothing in the world other than what Allah has proposed for you.
That's amazing conversation, ma'am.
Thank
you so much.
Oh, you're most welcome.
Thank you for your time.
Thank you.
I really appreciate, I really admire your time.
That's
thank you so much, ma'am.
Thank you.